player. Come on, friends.
There we go. Does that work for everybody? Yes. All right. So just fun things with the neck. I'm just going to have Claire stand here, and she's going to go through a couple different motions for us. So just with dealing with like the motions of the neck and everything, one of the things that the neck can do is flex, right? So that would be taking the chin down to the chest, right? Simple, easy maneuvers there. It can also extend, right? So that would be taking the back of the head and trying to get it back towards those shoulder blades. Wow, you have really good range of motion in flexion and extension, just so you know. Nice. All right. Another motion that we can do with the neck and everything is we can rotate to the left, all right? So that would be her taking her nose and trying to get it over towards her shoulder, all right, and rotating it out that way. Come back to the center. And then we can also rotate it to the right. A little bit more tight there, huh? Oh, okay. And then we can also do some lateral flexion of the neck. So we can laterally flex to the left. So that would be taking the ear down towards the shoulder. And then we can also laterally flex to the right side. Also a little on the tight side. How interesting. Nice. So again, trying to do some like body reading even and using ranges of motion to tell us like what's going on with this neck and what things we might want to work on. Those simple ranges of motion right there are pretty huge, right? So when she flexes down and she does just a regular flexion of the neck, the chin's pretty much almost touching the collarbone, right? Or right at the clavicle sternum area. And she, if you can see from the side, she's got quite great flexion at that neck, right? It's pretty good. We can also have her come back to neutral, and then we'll have her do some extension at the neck. So go ahead. And again, pretty amazing as far as extension goes. I know I can't get that far. All right, so it looks like her flexors and her extensors down on the neck area seem to be functioning pretty well because they definitely have full ranges of motion there. When we go to something like rotation to the left side, I'm gonna have her turn her head to the left, right? And it goes pretty good. I'm gonna turn her, right? So she can almost see the camera when she's on the side there, right? That's pretty good as far as rotation goes. Maybe slightly impinged, but not that bad. We're good. All right, I can also have her go and do rotation to the right. I don't know if you can see as much on the video, but her right side rotation is a little on the restricted side. You can't quite get all the way over so that her eyes are looking at you. There's a lot of other things moving at that point. So, all right. So then I'll have her come back to neutral. So that's telling me that her right side rotators, the muscles that make her neck rotate to the right, are a little on the shortened and contracted side. They're kind of tight. So those would definitely be some muscles that we could work out to try and get her better range of motion at her neck. Another great one is flexion, right? Lateral flexion. So again, I'm going to take her, I'm going to do left lateral flexion. So her ear is going to come down to her shoulder, right? Not super horrible by any means. Rotate it to the side so you guys can see. Then come back to neutral, and then to the right side. And a little bit more restricted. Not horrible. All right, and then come back up. Is there anyone that feels tight to you? Any of those ranges of motion?
Rotation to the right, and then lateral flexion is on both sides.
On both sides.
Yeah.
Okay, so that's fair, right? So even what I got to see with her ranges of motion, finding out how she feels about it is going to be another huge factor into like what muscles I'm going to start to treat. So somebody comes into your treatment room or your spa or what have you, and all of a sudden they're like, oh, it really hurts when I do this. You know, take them through some different ranges of motion and see what feels stiff to them, so that you kind of have an idea of what's working, and then getting them to breaking down all the ranges of motion into their specific ranges will help you out also with trying to figure out which one's tight and which one's not based on what they can do or can't do. Are we feeling good so far? 3 minutes.
Yes. So far, so good.
All right, I like it. Yes, I love thumbs up. That always works. All right, perfect. So yeah, another thing that we can start to look at, because they all kind of like start to interplay in together, is like her shoulders. Right? So because the shoulders and the neck sit so well together, looking for that rounded or interiorly rotated shoulder type of a thing might have a lot to play with on the neck. As you can see, as I push her shoulders in together, her neck kind of gets all kinds of jacked up as well, right? So that's where like a lot of that forward head posture comes in. So forward head posture would be the head coming forward and then looking up into the horizon. So if you can see from the side, it almost looks like kind of like a little turtleneck type of a deal. All right, there's a lot of flexion going on at the lower part of the neck, and then up in the suboccipital area, there's actually a contraction there as well, because it's holding the head so it can look up to the horizon. All right, relax, because you're gonna die. All right, so with with forward head posture, a lot of times what you'll see is a rounding of the shoulders as well. So whenever you're dealing with something like a forward head posture, oftentimes you're gonna have to work the shoulders as well, just to get those to relax and come back to normal resting position before you get even into working into the neck. All right, does that make sense so far?
Yes.
Yes.
I like yeses. Yeses work, thumbs up work, any of those things work for me. I just need to make sure you're still alive with me here. All right. Oh, Julia.
Demerit.
Demerit, Julia, demerit. She probably can't even hear me. She's still probably signing in. Julia, I know you just got in. Make sure you put your name in the chat box with your campus so I can make sure you get attendance for today. Okie dokie. I think what she meant to say is okay. Awesome. All right, so let's start looking into different neck muscles that we're going to start to work on. We're really going to focus here on the neck itself, but I want to make sure that I hit up below the clavicle. So I'm going to work into subclavius a lot. Also with things like the scalenes, they attach deep into the first and second rib down here. So working below the clavicle where it kind of like goes into that first rib is going to be really important to helping the scalenes relax. Scalenes are a big one for pulling your head this way, right? They're going to be more of a flexor. So if somebody's dealing with something like a forward head posture, this is going to be a very tight area for them. So being able to work the attachment sites and being able to work the bellies, the muscle bellies of the muscle are going to be really helpful for kind of getting it to relax and everything. We're going to work right at the clavicle itself. All right, so right in through here is going to be where different attachments are going to hit in. Your scalenes are all going to dip underneath the clavicle, and then you've also got your SCM that connects right onto the clavicle. So if we're going to do anything, any of these flexors that are like contracted short and very tight, we're going to want to make sure we work the attachments for them along with the muscle bellies of the muscles. All right. Other muscles that we're going to get into, we talked about scalenes attaching here. They come up through the neck and they attach into the transverse processes over here on the side of the neck, right at the side of the vertebrae. So making sure that we hit the attachments here, and the muscle itself is going to be our best bet for getting everything to kind of relax. All right. Same thing with SCM, sternocleidomastoid. Sterno meaning attaches at the sternum, cleido meaning it attaches at the clavicle, and mastoid meaning it attaches at the mastoid process. All right, we're going to make sure that we hit all three of those attachment points along with the actual muscle belly itself. All right, so again, all big things as far as getting the neck to relax. Sternocleidomastoid in particular is an opposite side rotator, right? Meaning that the right SCM is going to turn the head to the left, and the left SCM will turn the head to the right, right? So it's a little counterintuitive almost. Scalenes itself, they're much bigger on lateral flexions, all right? So if she's feeling tight in one of her lateral flexions, getting into scalenes and the traps are going to be a huge part of that because of how they attach down here. We'll hit up a little bit more of anterior traps and everything in through here, and then we'll actually hit into, while they're face up, we'll get into the cervical spine as well. So we'll get into some of the upper parts of the erector spinae group. We'll get into some rotatories that are up here in the cervical spine. And we'll do this all kind of while she's face up because it's sometimes just a little bit easier to use gravity as your go-to. And then lastly, other spots that we're going to want to hit up is into, sorry, I'll turn around again. Suboccipitals, right? Attaching right at the base of the skull, going down into that first and second vertebrae there. We're going to want to make sure we get those for sure because again, with forward head posture, the bottom part of her neck is going to be going into flexion and the back part of her neck is going to be going into extension so that she can actually see things, right? So it's going to, so she can see the horizon. All right, come back to normal before you die. All right, and then we'll also want to go ahead and hit right up underneath the clavicle here, all right, or up underneath the mandible, excuse me. All right, because again, these are all going to be things that are going to be pulling down. So the more we can loosen this type of stuff up, the less it's going to be causing her to come forward so much. All right, sound like a plan, Stan?
Yes.
Yes.
Yeah.
Woohoo!
Yeah. All right. All right. Well, I'm gonna hop Claire onto the table for me. I'm gonna have her go face up, and then we'll start playing with camera angles so you guys can all see.
Do you want
these off.
Yeah, because I want to get into your possibility area.
Okay.
But here's that extra sheet. Or if you just want to take the shirt off and go run.
Yeah, it's like a
That's
sports
totally
sheet. So that'd be the easiest.
For me to hold the camera or?
Yeah, if you.
Yes.
Are we all excited to work on the neck?
Oh, man.
Love working on the
You
neck.
won't believe
Yes, we're excited.
Yeah,
You guys, I don't know if you guys are full of it or what, but I'll take it.
no, neck is legitimately my favorite.
That's how I feel. I was really excited to get the first dibs on the body parts today, so I definitely chose neck.
I wish I could be your demo right now. That's how I feel.
Oh, okay.
So what page in the book?
No pages really. Feel free to definitely take some notes if you want to. If you want to look up muscles that we're going through, I would recommend grabbing the trail guide. If you want to just see a couple different treatment settings or treatment options, I would say just kind of pay attention and take notes as we go through. All right.
Here in the massage therapy book, I think 526. You could look at.
Okay, that totally works.
526 through about 535.
I think this table's kind of a short table. Is it not?
It's a what?
Kind of a short table. Like my feet are on this stuff.
You're pretty far down. You want to come up a little bit?
Which is fun. My feet are off and we're so,
You're like, what are you doing?
maybe you could.
All right, so here's Claire, right? So we grab an angle so you can see her from here.
Yep.
If you notice, we can look at her shoulders and we can look at her arms, and that's going to tell us a lot about what's going on in this upper area over through here.
Well, like there.
Yeah, that works. So if you can see, sorry.
I dropped.
Timber. I would do it without that. All right. If you can see, her shoulder comes up quite a bit off of the table from down here. All right, and then right here we can see how high the shoulders are itself. All right, are we good so far? Yeah. If you look
Yes.
down her arm, and you can see her hands, you can see that they're resting like this on the table. If she was a little bit more normally comfortable, it would be resting with the thumbs up. All right, that would show a little bit of a different rotation going on here at the shoulder. All right, so again, if you think about anatomical position, it's with your palms facing out, right? That would be more normal or neutral. The more we get into these chronically contracted positions like driving a car or typing at your computer, that kind of a deal, what happens is your body starts to go into these like normally contracted positions, and this is going to be one of the first telltale signs for it. All right, so here we go.
Morgan, looking for thumbs up when they're in that position is where we're trying to get, that's where we want them to be? Thumbs
Yeah,
up?
you need to be more thought up, right?
Okay.
So, like with her rotated in like this, you can kind of see that her hand is down, right, face down, and that's how most people are because of how many things that we do in front of us, especially
Yeah, I
people on
got
the computer and stuff like that. Ultimately, what we want to see is more of this, where it's kind of rolled out.
Ah, okay.
All right. Now, if you watch her shoulder, when her hand is face down, see how high that is?
Yeah.
All right. Now, when she rolls her hand out, you can see how it starts to smooth out and come down a little bit more.
I've never even looked at that before, the thumb positioning.
Oh yeah. Sometimes
Okay.
sometimes working down the chain is just as exciting. All right. So put a little bit of cream under my hands. Poor Claire has not had a massage in forever, so we're gonna start out nice and slow and smooth with her. We're all dying. All right. Normally the neck is one of the things that I do last. I'm not saying that's right or wrong, but the body would be a little bit more warmed up than what it is right now. So we're just gonna take a little bit of time and get some nice, good Swedish going on and go ahead and start to warm up the neck area. All right, so I'm just doing some Effelrod strokes, going up the back of the neck, playing around with the traps, doing a little bit of knuckling into the trap area. Again, just kind of warming it up, getting it all ready for a little bit deeper work. A little bit more cream. All right, I'm gonna work all the way down through the chest, through the clavicles, so we'll make sure we get some time over here. All right, for any of my good old friends here in Mesa, know that my favorite color is red, so when the skin starts to change colors to a little bit more red, I'll be a little bit more excited.
Bright red.
Bright red.
Really vibrant, bright red.
That's my, yes, you know.
Like vermilion?
Like vermilion, yes.
I'm more of an aqua guy.
Aqua, what are you doing to your clients?
Giving them some good stuff.
Freezing them out with your aqua. All right. All right. So, as I started to work into some type of treatment here, the first place that for me I'm going to work on is going to be right below the clavicle. So here I am at the clavicle, right? And I'm just going to start at the sternum and I'm going to work my way out laterally so it goes out, and I'm going to follow it right out through the shoulder. All right. So again, I'm just using my fingertips, doing some effleurage, just making sure I'm real specific following that clavicle out. All right. Again, if you think about it, and people are short and contracted, they're constantly having this rolled in and coming more towards the center. So I want to start to open and elongate that a little bit more. Work one side. I'm going to go ahead and work the other. And I'm just sinking in as deep as the tissue will let me go. I'm not forcing anything in there. I'm not trying to cause pain, contrary to popular belief. All right. Now, as I'm starting to feel down and going through the different areas along the clavicle, you can start to feel some lumpy, bumpy, weirdo things in there, some spots of ischemic tissue, kind of bubble wrappy starting to feel. So maybe as I get to one, I'll just hold it for a second, do a little bit of trigger point therapy, and then come out, maybe do a little bit of circles on my way out, and continue on down, opening it up. If I happen to find one of these lumpy, bumpy things, these like little pieces of ischemic tissue, and my client was like, ooh, I can feel that all the way up into my ear, I'll know for sure that I'm on a trigger point, right? So again, at the same time, I can just stop for a second, hold it for anywhere from 20 to 30 seconds, and then be able to keep on going. How's it feeling there for you?
Good. No trigger points. No.
Nothing referring out or
Nothing
anything?
referring. I feel the lumpies and bumpies.
She feels the lumpies and bumpies. I'll take it. All right. If I was to do a little bit more with this, sometimes I want to get a little bit deeper into that first rib. So really, I'm going to find that clavicle and I'm going to sink in just inferior to it. And I'm going to angle down towards her feet. All right. And from there, I'm just going to have Claire take a nice big breath in. And a nice big breath out. And on her exhale, I'm just going to continue on down. I'm going to go a little bit more lateral on the clavicle. I'm going to do the same thing, right? So I'm going to sink in just below the clavicle. And have Claire breathe in. And then breathe out. And continue on down. That's a really nice way to get into a little bit more deeper work and letting the client do some of the work for you, right? So guys, breathe in. And breathe. All right. So the way that the scalene's attached is right into that first rib, right at the, right into the first rib. One of the things that scalenes is really good at or is helpful with is forced inhalation. So sometimes as I get into some of those like ischemic tissue spots or I get into one of those trigger point areas, I can hold on to the area rather than me pressing down and causing more discomfort, per se. I'm going to have them breathe in, because when they breathe in, they're bringing the chest cavity up and they're starting to contract those muscles. So all I have to do is hold it there. And what they're doing is putting pressure on the tissue for me. And then I'll go ahead and swing it right on out. starting to see lots of good old blood flow going in through here. You can do little circles in through here. If I happen to stay on one spot, if I find some lumpy bumpies. And again, the whole time, I'm just hugging in through the clavicle. I'm following it out down the shoulder.
Morgan, your microphone's getting kind of muffled. I don't know if it's for everyone.
Maybe
Is that better?
It's covered up somehow.
Yeah, I
the
think
mic is covered.
All right, no worries. Thank you. Is that better? Can you hear me
Yes.
now?
Much
Can you
better.
hear me now?
Yep.
Okay, good. Thank you. Don't be afraid to tell me those things because I would never know. All right, so if you want to come, I'm going to move the camera so that you can kind of see from my angle. Even just working a little bit on that clavicle there, you can see how this shoulder is starting to drop down a little bit more. All right. So, and that's just working just below the clavicle. So now I want to like jump up a little bit more and I want to work right at the clavicle, right? So again, SCM, which is your sternocleidomastoid, attaches right here and then comes up in behind and under, and behind the ear. So if I can work some of the attachments for that, that's going to help loosen any part of this muscle through here. All right. So now I'm just going to take my finger and kind of rest it on the clavicle. And the first couple times I go through, I'm just going to drag my thumb following right along the actual clavicle itself. Got Claire the perfect color that I love her to be at. All right, and as we continue to do the stroke, you can kind of feel it start to get a little bit warmer and a little bit softer. You can sink in a little bit more. Now, when I sink in, I'm sinking in inferior towards the feet. I'm not sinking in posterior towards the table, otherwise I'm gonna choke her out. And that would not be fun. All right, so again, I'm gonna sit right at the clavicle there. I'm gonna be a little bit dramatic so you can kind of see it. And I'm gonna push down towards the feet and then laterally out following the clavicle. I don't want to go underneath the clavicle, right? There's too many like big vessels and vasculature out there, and that's not something that I'm excited to get into. I don't want to have to hit into any lymph areas. There's a lot of, nerves that go through there that I don't want to cause any kind of impingement on. You've got some major blood vessels coming up and down from the neck area, so I don't want to impinge those either.
Do you always do one side at a time as opposed to both at the same time?
I definitely go back and forth. The reason I wanted to do one side is so you guys could see a little bit. So I'm gonna have the camera come like over my shoulder here. And if you can see Claire's hands and her shoulders, just again, from working this one side, see how this hand is starting to come out and roll out a little bit more. And this one hasn't moved at all.
Yeah.
You can also
Wow.
see the shoulders here are really starting to like lower in his gut. So I'm like really big on like proof in the pudding, right? So like making sure that like there's like things happening when we do the work. And this is like one of those big pieces for me, is being able to see like what's going on. Now, am I gonna like roll her hand out so that it goes like this? Absolutely not. But you can see already just by loosening that area how much the shoulder is starting to come back and the neck is starting to relax a little bit more.
Okay.
When it comes to certain things, sometimes I'll do like a little bit more on the right and then go to the left, but I usually work the neck as a whole because I think it's important to think of the body as a whole, if that's any help.
Gotcha.
Nice. I love questions. Feel free to ask questions. Are you guys any questions so far on this? Going with no. Okay, fine. So if I want to do a little bit more, as I'm going down the side of the clavicle here, right? This is one of those spots where you'll often find some ischemic tissue, like right here. So again, I'm just going to stay here, maybe do a little bit of rocking, give it a couple seconds.
Morgan?
Yeah.
Where exactly are you? Like
Where am I on the body?
Yeah, like what are you pressing down? Because it seems like you have the base of your palm against her clavicle. Is that literally who you are?
It's more this part. Most of my pressure is coming from right here, but my thumb is dragging along to elongate the stroke.
Okay.
Does that make sense?
Yes.
This is here, like the rest of my hand is kind of like on her shoulder, guiding me the way, but the pressure is really coming from that thenar imminence area.
Okay.
Does that help?
Yes.
Okay. So again, coming back through here, kind of find that like little bit of tightness right where that sternocleidomastoid attaches. I can tell by some wrinkles in the eyebrow that we might be on something, and then kind of keep on going down. Was that referring anywhere? Or was it just uncomfortable?
I don't know if it was referring.
So at that point, I have a couple different options too, right? So I can stay on it and just do some ischemic pressure like I would for like a trigger point of some type, or I can stay and do a little bit of friction right at the clavicle, right? So at this point, I'm doing a little bit of cross fiber friction there. And we can start to feel a little bit more over here, kind of where the attachment of the traps are. Right, so let's do a little bit of friction right in through here, and then follow it out. Love that. Feeling super warm in the neck right now. I'm loving life. So I'm gonna actually go back to just below the clavicle and see if I can get that any looser or any warmer. So again, I'm at the clavicle here. I roll over it, sink in, and just start to follow it out. All right. How are we feeling so far? Doing okay?
Yeah.
Yay.
Very
So the
neglected area.
Very neglected area. Oh, see, we're all stressed out. That's the problem, right? So just like I had her do when she was standing, we did a little bit of rotation or a little bit of movement with the neck. So I kind of want to do the same thing. I like to do it after I warm up the base of the neck so I can see what's different. So now that I have her, I might just go around and dip up underneath, come back up, and let her head rest right into my hands right there. All right, I'll just give it a minute, see how much give she's going to give me as far as this neck, because a lot of people, it's very sensitive area, so they're not easily to give it up for anything. It is, yes. All right, so now I kind of want to just check ranges of motion with her, right? So here I go. I'm going to do all the motion, so it's going to be nice and passive, and I'm just going to take her neck all the way up and we'll stretch out the bottom part of that neck. Right? Just going to where I feel restriction, not trying to push it any further past. And also do the same thing and start to check out extension. I'm really only going to be able to get into the suboccipitals at this point unless I hang her head off the edge of the table, and that's not really my bag. So I'm going to sink my fingers in right at the suboccipitals, and then I'm just going to rotate so her chin goes right to the sky and see what kind of extension we can get out of that. Pretty good. Shocker, just as good as it was when she was standing. Many people will not get that far. All right, next thing I want to do is start to do some rotation, right? So I'll rotate her head to the left. So I've got her head, I've got my hands on either side of her head, and I'm just rotating it over, trying to get her ear to hit the side of the table. All right. I think I'm pretty damn good on the rotation aspect of it. All right, we'll bring her back to neutral. And we'll go ahead and do the same thing with the right side rotation. Already looks better. All right, and then we'll bring her back to neutral. Notice, what's that?
It feels better.
Yeah.
The left rotation referred like down into like mid-scap area.
Left rotation will refer down into mid-scap.
Yeah.
Ooh, fun. Left side we
Just
haven't
for
done
fun
yet.
things to let you
I like that.
give you feedback.
Other things I want to check out are her lateral flexion, right? So I'm going to take lateral flexion to the left. I'm going ear all the way down to the shoulder. And then I'll come back up to neutral. And then we'll do right side lateral flexion from ear all the way down to shoulder. Anything on that one? So now that we've gone through a lot of the motion, right? She's already got better rotation just from the little bit that we've done down here, but we're gonna keep on going because that's just the way it goes. But now that I've gotten her to do some motion, I can also start to work any of these areas with her doing some motion, right? So one of the great ones is right here at the clavicle. As I start to go down this way, I'm just going to passively rotate her head to the left while I'm going down and effleuraging down the top of the clavicle there. All right, so this just becomes a little bit more intense on the intensity scale because we've added some motion into it. I also find it's really a lot easier to start feeling inconsistencies with the tissue when it's in motion, right? Because you actually get the movement of the muscles underneath your fingers. Right. Another way to work on a trigger point here, because I keep finding a little bit of something here, is I'll come in, I'll sink into that area of ischemic tissue, and while I'm holding it here, I'm just gonna rotate her through it. All right, so I'm not necessarily gliding and having the muscle move underneath my finger. How you doing?
Good. I feel what you're feeling.
I feel what she said. I feel what you're feeling, so that's exciting. If I wanted to up the intensity even more, if I was working with somebody who might have more of a strain and stuff like that on their neck, or if I was concerned because the person wasn't giving me their neck, I get them to be a little bit more involved with it. So this time I'm going to tell Claire, how about you rotate your head to the left, right, while I'm working on the stroke. So we'll do it together. I'll hold in here. I'll say, go ahead, rotate your head to the left, and I'll do my nice little effleurage stroke going down. Right? Again, it kind of ups the intensity, but it also puts a lot of the pressure on the client so that they can decide how much pressure they can really take. Nice. How you feeling?
Good.
Yay,
Blood
she's
flow.
feeling good. Blood flow, is that what you said?
Mhm.
I'll take it. All right, so let's work up the neck a little bit more. So again, I want to make sure I get underneath the neck. Make sure I do some, I don't know, let's do some knuckling strokes underneath here, right? So just taking some soft fists all around that shoulder blade. Getting some nice red blood flow in there. I mean, we did such a good job on the first part of the neck. We want to make sure we get in there good. And hit up the traps. You can usually feel some lumpy, bumpy things in the fader. All right. So now I want to start to warm up this side of the neck for her. So, excuse me. I'm going to start with the back side of my hands, and I'm going to go right at the clavicle, and I'm just going to take the back side of my hand and go down towards the table. So working posteriorly on the butt. All right. Curl my fingers until I hit my knuckles down. All right, so what this is doing is starting to warm up and get some blood flow into that anterior trap area right in through here, and then still working on some of the work that we did over here at the beginning of SCM right at the clavicle attachment. If I rotate my hand so that it's facing the neck a little bit more, again, using the backside of my neck, you can see right here, this is SCM. So if I take the backside of my hand and go right down SCM, so again, pressure is more down towards the table, not in towards her neck, so I choke her out, and go right into that little crease area, that little angle, and get some nice blood flow into SCM. Again, working nice and slowly. We're not in any kind of rush here. You okay?
Yeah. What's going on there?
All right, so I could do that with her absolutely stationary like that. Again, I'm much more of a movement person, so I'm gonna start at the first place, right over the clavicle. I'm gonna come down, and as I do that, going down towards the table, I'm gonna have her rotate her head in the opposite direction. Or excuse me, I'm gonna rotate her head in the opposite direction. So it'll be a nice passive movement at that point. You turn my hand, go more towards the crook of the neck there. And again, as I go down, I'm gonna have her go ahead and do some, I'm gonna passively move her neck so that it rotates to the left.
Sorry to interrupt.
No.
I saw in the book, one of the massage book, the new one that we have, you know, how it draw like endangerment zone around the triangle neck area.
You got it.
So is that okay that we work, but like that, like soft, not hard, right?
As long as you're not pushing down and like going in to choke them, it's totally fine to work this area. The endangerment site is right here.
Right, okay.
All right, so as long as I'm not poking into this area and going any kind of craziness deep in here, you're good to go. But as long as you're nice and flat going along the back side of it, and again, on a scale of 1 to 10, how deep is this pressure for you?
Okay, I see. Yeah, I always have question about that, and I'm kind of scared.
Yeah, no, and that's good. You should be scared starting off, but don't be afraid. As long as you're not poking in here and going anything deep, right? Like, so I'm not trying to go underneath the clavicle. That would not be good. I'm not trying to like trigger point her in this way because that would also not be good. But since it's a nice flat hand and my direction is down towards the table, right? I'm not going into that endangerment site. I'm more just hitting the anterior side of the traps here.
Okay, I see. Because in the book, it's not really like explained that way, you know.
Yeah,
Okay,
well, it's like everything else. It's very layered, right? So when you first start massaging, we're like, don't touch here, don't touch here. And then as you get into different areas, it's kind of like, all right, well, don't touch in here with sharp, pointy fingers, that kind of thing. But that was a good question.
Thank you.
Oh my gosh, anytime. So again, I'm in the crook of the neck, just kind of doing some passive range of motion, having her rotate to the left. All right. If I wanted to up the intensity a little bit more, or if the person was fighting me or giving me any kind of issues with it, I might have them do the range of motion. So I'm going to start up here at that first spot, and I'm going to have Claire go ahead and rotate her head to the left while I just sink down into the table. All right. Come up to the crook. Go ahead. Nice. How you feeling so far?
Good. Those first couple of passes went like right up into like that mastoid.
Oh, okay.
Yeah.
And how are they feeling now?
Oh, good. We just hit the first two.
No, that's
And then
fair.
it,
That's
like,
fair. So again, so she was just saying that like she could kind of feel it shooting up into the back of her ear here, right by the mastoid process and stuff like that during the first couple of strokes. Lightening up wouldn't have been a bad thing, but even after just a couple of passes, it didn't, she said she wasn't feeling that anymore. So, which is good, because sometimes you don't need to sit there and hold on to a trigger point for very long. It's just a matter of getting more blood flow to the area so that those ischemic tissue pieces can start to get more blood flow and start to flush themselves out. So that's all good stuff. I'm happy to hear that. If I wanted to do more with elongating the stroke, so if we were having problems with rotating our head to the left and lateral flexion and stuff like that, I can start here. I'm going to go down towards the table, just like we did with the first part of the stroke. Right as I get to the traps, I'm going to rotate my hands up, and I'm going to follow it up while I rotate her head to the left. All right, and my knuckles will come right to that suboccipital occipital protuberance. All right, take her back to neutral. I'm gonna come down towards the table. As soon as I hit the anterior part of the traps, I'm gonna skyrocket right on up the back of the neck. Do that a couple of times. Can start up a little bit more into the crook of the neck, right? So a little bit higher where we were the second stroke. Follow it all the way up. Again, right up to the occiput. As you get a little bit higher up on the neck, you're not going to be able to turn your wrist as much. So I'm just going to come down. And as her head rotates, I'm just going to kind of do a little bit of a turn to the left till I hit the side of the occiput. Nice. All right. Neck, beautiful red neck color, my favorite. She's a honky tonk. All right. So now again from here, I kind of want to get up. So we've started to like warm up that whole area. I want to get a little bit more into the suboccipitals, right? So from here, I'm just going to take 2 fingers and I'm going to be using the side of my fingers right here. All right. So when I come up, I'm going to feel for where that occipital ridge is or that occipital protuberance. And I'm just going to run my fingers right along there. Okay. Working medial, then lateral. I can also rotate her head all the way to the left. Hold on to that hairline there. And I can feel where that bony ridge is, right? And again, I'm just going to work medial to lateral.
Morgan, you make that look so freaking comforting right now. Like, oh, I feel like I can feel it in my head right now.
Oh, that makes me feel good. Thank you. A+ for you, Jay. Nice. So I'm right at the occipital protuberance right now, kind of going back and forth. I can also do that cross fiber bit, working down the neck a little bit more, right? So if you notice, you can kind of actually you can see really well. You see that like this thing right here? That's the big old SCM. So I can just start to go across it and do some cross fiber friction on my way down. Follow it back up. Again, right at the occipital protuberance, occipital ridge, and then just start to go back and down. Nice. So if I wanted to combine some of these things all together, I might do something along the lines of coming down the clavicle area, rotating the head to the left, jackknifing so that I come all the way up to the protuberance, right? And then from here, I can go back and forth while she rotates her head back to neutral. All right, so just taking all of those and kind of combining them. Ta-da! It's usually at this point, if I was in my own practice, that I would start to integrate different things. And one of my big things is cupping. So for me, after I get some of this stuff all in and working, I might take some of my cups and kind of go back over a lot of the areas that I was just working on, right? So at this point, I'm working just below the clavicle, working all the way out through the shoulder. Ooh, it's kissing you. Do a couple passes, not looking to leave marks. Sometimes it happens.
I never see that before. What is that for? Like, what does it help with?
The cupping, what it'll help do is bring some new blood flow into the area from deeper in the tissue, and then add in some separation in between the different layers of the muscle.
Oh, okay. And you can get it at the massage place, or you can order online or something?
Absolutely.
Oh, okay. Cool.
All right, sometimes I'll even take it from the shoulder and again, help to run right over the side of it there. All right, again, just thinking that I want to get these rounded out shoulders to come back down to normal. Is this okay?
Mhm.
All right, I can also go ahead and I won't do too much on the actual clavicle itself, just because it's going to be a little bit harder to get the suction cups to stay on there. But what I can do is start to work in that neck area, right? So with her head in my hand, I can work from this base of the skull here, and I'll work my way down through the trap area. So again, I'm staying very much behind this endangerment site right here, and I'm just adding in a little bit of movement and a little bit of blood flow with cups. Good old hairline. They are kissing you today, huh, boy? Girl, my bad. All right, I can also work through SCM. The deal with this is that I'm going to be working very dramatically with the lymph drainage, right? So I'm going to start down here more towards the neck area where it drains in, and I'll work my way back up towards the mastoid process. By adding a little bit of cupping into here, I'm getting more separation in between the tissue, so it'll be easier to start to maneuver and manipulate her neck as I start getting into some of the deeper work. All right, as you can see, it very quickly and very evenly brings blood flow to the area. I'm not doing any kind of dragging with it. It's just suction and release through the whole thing to see if I can get some more blood into that area. And again, opening up the tissue separation. All right. Yay, even more beautiful redness. All right. From here, we can go ahead and get into more of the muscle belly as far as SCM goes. Sorry. So again, I'm going for a little bit of cream here, not tons. I don't want to have like lots of oil on the neck. To get my hands back in there and feeling good, I'm going to grab one hand underneath, holding onto the posterior part of the neck, and then that thenar eminence on my thumb, and start to just warm up and make sure it knows I'm coming for it. All right, so working with some of the stuff with SCM, I can go ahead and rotate Claire's neck to the left, all right? You can already see it on hers because she's got such a perfect neck for this, right? But you can already see the SCM, that's it right there. It's like already screaming up at me. If I had more of a hidden SCM, as I know many people do, I would have her just take her ear up to the ceiling. Go ahead. I'm gonna have you, yeah, that.
Oh, okay.
All right, so relax. So what I'm gonna do is have her flex her neck in this way, and I'm gonna tell her to take her ear to the ceiling. So go ahead and do that. And you can see how that muscle really just pops right out there. All right, that's SCM, and that's the muscle I wanna get. So I'm gonna take my wide open fingers, I'm gonna take my thumb on the anterior side and my fingers on the posterior side. Go ahead, relax. As she relaxes, I'm gonna make sure I have that muscle belly, and I'm just gonna glide up it as I rotate her head back to neutral position. All right. It's not a pressure move, it's more just making sure you're on the right muscle. So again, I'll have her take her ear to the ceiling. Bam, there's the muscle. I grab it, I tell her, hey, take a relaxing breath for a minute. Yeah, relax your neck. Right, and as I have it, I'm just gonna take my finger and glide right on up. All right, again, I'm not pinching anything through for Claire. I'm not grabbing it like a vice grip. I'm literally just running my fingers along each side of it making sure to get the back side of the SCM and the front side of the SCM to bring in some blood flow and kind of compress it, but I don't want you to think of pinching it by any means, all right? If you know it or you can grab it, you don't need to have them raise their head up. You can just have them relax and be normal and then grab it. As you can see, my fingers are grabbing the posterior side. My thumb's just riding that anterior side. All right, come up and I'll rotate her head up and around. Sometimes you can even go ahead and pin it all the way around and then come back to neutral. How's that?
Good. I liked that move when you taught us.
Yeah, I love this one. All right, so it's starting to kind of put together effleurage and ranges of motion into your own treatment setting. Sometimes when you go up through here, you'll start to feel things like, I don't know, maybe right here I would feel a little bit of a ischemic tissue. I can, again, just hold it right here. What's my pressure at for you right now?
Maybe like a 2 or 3.
I'm at like maybe a 2 or 3. I'm not holding on for very long, and then I'm going to follow it all the way up. All right, so if you come across any kind of ischemic tissue, which this is very normal to find some, if you come across a trigger point and stuff, you can still treat it. It's not about the depth of pressure at that point. It's just making sure you have the right area. Do that a couple of times. Do one more for good measure. How you feel?
Very aware of my left side.
Very aware of her left side. That would be the side we have not worked on yet.
Right side is great.
Nice, I'll take it. That's awesome.
Like a different neck.
Whole new neck. Another thing that we can do to add into some of these spots is kind of do some more with range of motion. So those are all great ways to start adding in with effleurage and getting some blood flow in there. If I wanted to use more proprioceptive type techniques to get the muscles working the way that they need to, I do some resistive ranges of motion, right? So again, this becomes a little bit more interactive with your therapy, and that's totally fine. It's just a matter of what type of setting you're in. Oftentimes in like a medical type setting, or in somebody who's in pain, they don't care what you do. They just want to make sure that you get them out of pain. If it's more of like a spa relaxation type of a thing, you probably won't have as much of an interactive session as what you could, let's put it that way. So again, kind of thinking with this whole side of the neck here, I want to start to add in a little bit more with range of motion. So one of the stretches I could do is to grab her neck and take her into lateral flexion. Right? I'm going to take her to just about the end range of motion. I've got my hand supporting her, her neck here, my opposite hand across the way, supporting the shoulder, and I'm just going to lean in a little bit. Right? Come out and bring her back to neutral. If I wanted to add in a little bit more than that, again, same thing. I'm going to take my hand, I'm going to take her out to almost the end range of motion here, right? Then I'm going to support her shoulder on this side, and I'm going to ask her to take her ear to her shoulder. Go ahead. 2, 3, 4, 5, 6, relax. And then I'll take her into a little bit further of a stretch. All right, bring her back to neutral. Try that one more time. So that's one of your PNF stretches, right? I'm going to take her into an elongated muscle. Hold it right there. I'm going to support her opposite shoulder. I'm going to say take your ear to your shoulder. Go ahead. 2, 3, 4, 5, 6. Relax. We're going to take a breath together. And then I'm going to take her into her next end range of motion. I'll take her back to neutral. All right. And so each time you can kind of see the neck getting a little bit further in there. How you feeling? Good. Good. Same thing with rotation, right? So I can take her into rotation to the left. I'm going to support the back of her neck with one hand. I'll take my other hand with the opposite shoulder, and I'll stretch out this way. So now instead of getting those lateral flexors, I'm getting more into the traps here, right? So I'll get into some traps, a little bit of, a stretch to the suboccipitals as well. And go ahead that way. So that would just be a nice, bring her back to neutral. If I wanted to do a little bit of PNF stretching in there, I could do the same thing. I'm gonna rotate her head to the left, take her towards the closer end of her motion. I'm gonna support her shoulder. I'm gonna tell her to take the back of her head to her shoulder. 2, 3, 4, 5, 6, relax. We'll take a nice breath together. And then I'll go ahead and take her into the next end range of her stretch.
I think my shoulder's in the way.
She goes, I think my shoulder's in the way. Agreed. All right. So that would be some different ways you could add in some PNF stretching into all this fun stuff. How you feeling so far?
I'm so aware of my left side.
Okay, good. I'll take it. Nice. I'll take it. Trying to think what else we could do for here. So getting into scalenes a little bit more, right? So I can go ahead and run my fingers down here and start to work on, this is gonna hit up some of the trap area, and then you'll be able to get into the side of the scalenes over through here. All right, so again, I'm just taking the back side of my hand so it's not tons of pressure in there. And I'm just running laterally down the neck from the ear to the shoulder. And because I've warmed everything else up in through here, I'm really able to sink into the tissue, and ideally this isn't too much pressure for you. All right, if I was going out this cold, again, I like to do a lot more of that warm up first. That way you can get into some of these areas a little bit deeper. Now, if I wanted to add in some more movement with her, I might tell her while I'm coming up here and going down through the neck this way, I'm gonna have her take her ear on the opposite side down to her opposite shoulder. So go ahead. Right, and help out with that stretch. We'll do one more. Nice. Ooh, sounded like a good one. All right. So now let's get into a little bit more of the posterior neck muscles, right? Now that we've worked on all these good ones. So one of the first things I can do is start to work really in that lamina. You okay? Mm-hmm. Okay. Work in that lamina groove right along the cervical spine. So once I get her neck up there, I'm going to take my thumb and my first finger and I'm going to put them on either side of the spine so that they're kind of like this. And I'm just going to run them up and down from medial or from superior to inferior, up and down the cervical spine. Ultimately, what that's getting is right at the attachments of where the erector group is in the cervical spine. So I'll just come up underneath here. I'm going to find for where T1, C7 is, that big bumpy sticky addy vertebrae that's in the back of the neck, right? I'm going to go on either side of it, and I'm just going to start to run superior and inferior. As well?
It looks there.
You got a couple fun ones in there, huh? All right, so again, just taking some time to really do some nice effleurage, a little bit deeper than normal, a little bit of stripping in there. If I find something like here-ish, right, a little something, is it referring anywhere?
No.
Okay, so from here, I would just go ahead and the hand that's holding her head, I'm just gonna let it go a little bit. So now I've got gravity letting her head just get heavy right on top of that trigger point or on top of that ischemic tissue. And then I'll kind of come out of it nice and easy like, all right? That way I'm not feeling like I need to go up in there and really press hard up in there. I'm just letting gravity do what it needs to. And I'll finish it all the way out. All right. Another thing we can do where gravity is really helpful for us is we can go in between each one of the vertebrae. So when I go, hang on, I gotta admit somebody. So when I go underneath the neck behind it, I'm going to find where those spinous processes, the sticky bumpy addy things right on the spine that are right at the posterior side of the body. I'm gonna find where it is, and I'm gonna go in between each one and kind of push my fingers anterior towards the anterior side of the body so that each one of them will start to cradle back and forth just like this. So hopefully we can do a nice good gimmick for you here, right? So here I am at the first one. Open it up between the first and second, or the 7th and 6th. It's really funny because on the posterior side of her neck, you can really feel how tight the left side is versus the right side. I'll have a lot of fun with this one, Macy. All right, so we're really working those little tiny paravertebral muscles there. I'm getting a little bit more motion into those. I can also do the same thing working right at the spine, right at the rotatories. So this time I'm gonna cross my fingers around together and kind of just work up and down, but it's gonna be in between where the spinous processes and the transverse processes are. So just to rotate her head over to the side. Right along here is gonna be where those spinous processes are. Right in through here is where you'll find the transverse processes. I'm shooting the middle, right in between here. All right, and I'll be working back and forth this way. All right, kind of thinking about the head going, no. All right. There we go. So here I am on each side of that spinous processes, and you can't really see from my fingers, but I'm just working in between spinous processes to transverse processes. You can see her head is just slightly starting to shake a little bit, right? Like she's saying no. Not huge movements in there. This is a nice one that you can do on both sides, but damn, that left side is really tight. Ooh, blood flow, she said, right? Take a little time, warm out those shoulders back down. Ooh. All right, and one of the last things that I think we'll do before we take a little bit of a break here is we can do some more of that stretching bit, right? So we did a nice range of motion where we took her head into nice flexion. I like to take the neck from here. Take my first two fingers. I'm gonna put them right at that suboccipital, and then I'm gonna help guide her neck down into extension. Right. Take her right into a full extension. Might even underneath the chin, give it a little bit of a pull. Right. So what this is doing is help to stretch all of the muscles in the anterior side of the neck while bringing some blood flow into the suboccipitals. All right, how are we feeling so far?
Wonderful.
I like wonderful, and I like thumbs up. Those are all wins for me.
That last maneuver looked so good.
Oh, yay. That makes me smile. All right, it's 1:25 right now. Do you guys want to take a 10-minute break?
Yeah.
Gotcha.
Also, let's take a 10-minute break. Do me a favor. I know some of my latecomers came on and stuff like that. If you came on late and have not done so, please make sure you put your name and what campus you are from into the chat box so that I can make sure you get attendance for today. Thank you. All right, it is 1:25 right now. We'll take 10 minutes. You at like 1:35-ish. Does that sound like a plan?
Yeah, is that when we need to have our tables up, Morgan, or after that?
No, I might have a couple more demo thingies to do. I'll give you another break before we get your tables up.
Okay, see you in a bit.
Okay, see you in a few. Hello, my happy people. Are we back yet?
Oh, right there.
Yeah.
Wow, that was real excited. Yeah, we'll let you do it. Are you guys excited? Are we back excited, or are we just like, yeah, again?
It's Saturday and it's sunny out, Morgan.
Do you want me to go out? Yeah, why don't you watch this outside?
Well, I guess I didn't think of that.
Yeah, well, that's what I'm here for. Thank you. All right. Well, let's do a couple more things on little Claire Bear's neck here, and then we'll give you a chance to kind of go through everything. All right. Any questions on anything we've done so far, or things that seem weird?
No, it looks yummy.
Yay. Oh, I love that word. Claire hates it, but I love it. Yummy, delicious,
Delicious.
juicy.
Oh, juicy is the worst.
Juicy. Love it. All right, well, just a couple more things to kind of finish up the neck on things that we can do to help again with this forward head posture and rounding of the shoulders. Excuse me, when it comes time for the neck, is we can go into just below the clavicle here. Or why do I keep saying clavicle? I apologize. Just below the mandible here. Again, I'm going to start from the medial side, and I'm going to work my way down towards the lateral side. And I'm going to stop right at the ramus, all right? I'm not going to want to go in deeper than that or further back than that, because then I get into a whole bunch of nerves and blood vessels and things that I do not want to be putting any kind of compression on. All right, so again, I'm just taking a nice little curl of my fingers here. 2, 3, 1, 4, whatever you can kind of fit. I'll probably just do 2 to start. And I'm just gonna hook up underneath the mandible there. And then I'm just gonna nice and slowly glide my way out and down. And you honestly will feel straight bubble wrap through that whole thing. All right, I can support the back of her neck so that while I'm going down there and into it, maybe I'll find a little something, some ischemic tissue right there. I can put a little bit of direct compression on it, a little bit of direct compression, and then keep on going. That sucker just slid right out, huh?
Mm-hmm.
All right. Again, feel some of that ischemic tissue. Just hold it in place, a couple seconds, and then continue on down. All right. If I wanted to add in a little bit more movement to this, I could have Claire slowly open her mouth while I'm starting from medial and working my way lateral. All right. So again, you're gonna have to work with your client on this one. Sometimes it's not the easiest move in the world. So I am sinking in just a little bit medial there, and then I'm gonna have her slowly open her mouth while I go ahead and strip right on down. All right. One more. Nice and relax. All right, this is also another good one where you can kind of like let gravity and let the client do the work that needs to be done. If I happen to be going down through the mandible here and I find some type of something, like right here, I feel something. If I don't want to go ahead and push any harder upwards towards her head, I'm just going to ask her to slowly open her mouth while I sit there and hold the spot as she starts to open. So go ahead and open your mouth. Right. So she's sinking into the area and relax as I go ahead and hold on to the spot. All right, so again, she's doing all the work. I'm just kind of holding it in place. Okay, slowly open your mouth and relax. All right, yay. How do you feel, my dear?
Good, I think, yeah.
I think good. Nice. And then one of the other spots that we can get, which I find really effective and helpful, is getting into the anterior scalenes. And this one definitely requires talking to your client about it before you go ahead and do anything. Excuse me. When we go into the anterior scalenes, I need to get behind where SCM is here, and I need this trachea to be out of the way. All right. So I'm going to take some soft fingers fingers on one side and then my thumb on the other. And I'm just gonna go ahead and move her trachea from left to right. All right. Sometimes you'll hear some grinding noises. That's fine. It's very much cartilage on top of cartilage. So you'll hear some of those grog, 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 grog type of feels to it. As long as it's not painful, you're good to go on that. It's really just cartilage moving over it. I'm just going to take a little bit of time moving it from side to side, making sure that everything's a-okay with her. How you feeling in there?
Good.
Good.
I
She's
don't
like,
think anyone has ever done that.
really?
So,
All right, fun. All right, so now I've got her trachea and I've like can kind of figure out where it is. One of the spots that I'm going to make sure that I don't, if I start to feel a heartbeat, I know I need to be out of that area, right? That's a big one for me. So for me, I'm going to start right at the trachea and I kind of like slide right off of it. And then I know that I'm not in any vessels. From here, I want to go ahead and I'm going to move the trachea all the way over to the other side, right? So that it's as far over this way as I can go. And then I'm going to take my two fingers and I'm just going to go, or one finger, I guess I should say. And I'm going to start superior. I'm going to work my way inferior. All right. I'm going to switch hands because this is not working out well for me. All right. So again, you can see SEM right through here. I've got her trachea out of the way. I'm just taking my finger and right there I can feel the attachment for scalenes. And I'm just going to run it right on down. Move it out of the way and go right on down. Nice. How did that feel?
good. I forgot to breathe. So.
It's really helpful to tell you if I had to breathe. That's a big one. Another thing that would have been nice on my part had I told her to swallow before we got in there. All right, because sometimes like people will be like, "Oh my god," and then all of a sudden there's so much saliva in the back of their mouth, and then they don't really know what to do with themselves. So yeah, so that's pretty much it. I feel like that was pretty good as far as neck protocols go and different things that you could do with them. Oftentimes, again, with them being face up, use gravity as your best friends, right? So anytime you can kind of get them to roll onto something, I think is really helpful, right? And just let the weight of their head kind of do what they need to. All right, so let's take a minute and any questions?
Morgan, does she have circulation, like signs of circulation in her forehead even? And just from the camera, it kind of looks like she's red. Is that normal?
I think she's just nervous.
Oh, okay.
I don't think so. I don't like forehead like up here.
Yeah, from my view on the camera, it's kind of what I was, not so much now, but a little bit ago when you were working on her. And I was just wondering when you're working.
Oh, no. I mean, it might have been profuse sweating from me like jabbing into her trachea area. But no, there's no redness up there.
Oh, okay.
And as you can see, even with all the redness that we like pulled in from earlier before, I mean, I know we just went on a 10-minute break and everything, but it was only 10 minutes. But you can see how much that redness has started to go away. The idea is not to leave like crazy, crazy marks on people. It's just getting blood flow in there so that it can get new, fresh nutrients in and things can start to heal themselves.
Okay. When you do cupping on the neck, though, is it normal to see like flush kind of in the face or anything?
No, you shouldn't get it too much in the, I mean, if you do it on the face, you'll get a little bit of redness in the face, but it shouldn't be anything that lasts very long. With me, of all the cupping that I do, the least amount of redness I get is actually in the face, just because I'm not, leaving marks on somebody's face, especially when they're giant circle hickey mark looking things. They probably will never come back to you.
Yeah, that's true. Okay.
So it's definitely, face is one of those that like, especially with cupping, even on the neck itself, with cupping in particular, like it's definitely one of those less is more, let's see you more often for less amount of time type of a thing, and not so much let's get digging in there type. Nice. Any other questions? Really? You can't think of a single other question at all, 40 of you people?
It's only 20.
Or 20?
Who would you do that anterior scaling work on? Like, what kind of issues would you be
Like-
looking for to
Like going in through the trachea here?
Yeah, why would I don't know, like what problem would someone present that would make you want to do that?
So that's probably one of the last pieces I would ever use if I was working on somebody's neck. And it's really for people who have really severe bad forward head posture. Sometimes older folk because they've been stuck in this position for very long. Or somebody who's been totally cleared and is okay to work on when it comes to whiplash. Because what'll happen is with that forward flexion and then rapid extension, usually that scalene area is one of the first that gets like really contracted and tight and can't seem to get any blood flow to it. So it's in a normal treatment, it's probably one of the last things I would do because I think you can get a lot more with your hands and your fingers and stuff like that. But if it's, you know, if I start working in here and this whole area is just bound up super, super tight and I've tried all my different techniques and back of the hands and different things, then I'll try and go in that way and see if I can loosen it up a little bit. Did that help?
That did, thank you.
Yeah, of course. All right, that was 1 out of 20.
Now, I know that area there at the trachea is extremely sensitive area.
Yes.
Probably the most sensitive area on the body, even probably more than the groins. So you would probably have to check in, ask people if they would care to have you palpate there.
Yes, that is not an area that you'd want to go into blind, and you want to let them know what you're doing too. Because as soon as you start to move that trachea from side to side, they're going to be like, what in the God's name? So make sure that you definitely talk to the clients, you know, I'm going to work into your anterior scalenes. I feel that they're very, very tight. Here's what I'm going to do. You can do it on yourself first so that they can see what's going to happen. And then the reason why. You know, the reason why we want to work the trachea and move it out of the way is because once it's out of the way, then I have direct access into the scalenes, right? If I don't move it out of the way, then I'm just pressing in on blood vessels. And if you just rest your hand right in between where the trachea and the border of SCM is, you can feel the heartbeat, right? It's a pretty normal place to take somebody's pulse. So I need that out of the way so that I can get in there and it's totally okay and it doesn't feel like I'm jabbing in or cutting off somebody's circulation. Again, when you go into that spot, if you feel a heartbeat, slowly take yourself out of that area because you're in the wrong spot, right? That's one of the ways we can do a nice, easy way to define endangerment sites, is if you start to feel a heartbeat underneath your fingers, you're on something you don't need to be on. Any others?
How often do you cause like an adjustment in someone's cervical spine when you're doing kind of more detailed work up there?
How often do I call like a change in the way that they're holding their posture?
Yeah, like little pops and crackles and stuff like that.
I never look to cause any pops or crackles.
No.
Just because that is completely out of our scope of practice. Sometimes you will hear a little bit of like movement or something because of the muscle work that we've done on them, and that's totally fine. But you don't want to go for the looking of trying to adjust somebody's neck as far as like a pop or a crack or pulling too hard or aggressively.
I just noticed that in my time with clinic, I just finished my clinic hours recently, and
nice.
probably
Good job,
9 out of 10 times when I'm working on someone's neck, like I will accidentally like give them an adjustment. So I was just curious if that was just me being too aggressive or it was just bound to happen.
Well, I guess it could be. I would definitely go, you know, work lighter to more deep type of a thing. It might be too much it might be too aggressive. I mean, we just did a lot of work on the right side of Claire's neck here, and I didn't hear a crack or a pop once. Did you feel one? No. Okay. So, yeah, I mean, maybe try going a little bit more gingerly. I don't think that would be necessarily a bad idea. But if it happens, don't think that you did something bad. As long as your intention isn't to adjust somebody's neck or to pop anything out, then I feel like you're totally you're in the right ballpark then. Did that answer your question?
Yes, kind of. Yes.
I don't think you did anything wrong. If you wanted to go a little bit slower and easier, I don't think that's a bad idea either. Are you really aggressive when you work the neck?
No, I feel like I'm pretty gentle. I don't know if I'm just getting really stiff clients or what's going on, but yeah, I've experienced a lot of little mini adjustments happening.
Yeah, I wouldn't stress about it then. As long as you're not going in there going kush and like ripping them around. And,
No, oh gosh, no.
I feel like you're good to go. Like things will happen for sure. There's plenty of times where I've gone down somebody's erectors and you'll hear pop, 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 you know, and my intention is not at all to be any kind of like aggressive or to cause that by any means. So yeah, as long as that's not your intention, I think you're totally fine on that.
Taylor is very aggressive.
I am not, David.
You are.
All right, any other questions? Sounds like somebody's making a cocktail. I'm very jealous. All right, well, let's come back and take a look at Claire's posture and see if we did anything to make any kind of a difference. If you guys can remember from earlier before, right here where her shoulder was coming down to the table, you can see a little bit of a change right on this side. Again, she kind of like, we took a break and before we should have done this and stuff like that, but you can already see that the shoulder's starting to drop down. Had I done more work on the anterior side of her shoulder and even on the posterior side of her shoulder, this whole thing would be pretty much down to the table at that point. If you come kind of on the side angle this way, you'll be able to see that the neck is a little bit more straightened and not as lumpy bumpy. Right? You can kind of see like a smooth topography up over on this side versus the other side, which still is a little on the lumpy bumpy side. One of the biggest things we can do to check how we did was to see what range of motion looks like, right? So let me go ahead and have you flex your neck down to your chin, or your chin down to your sternum. Looks pretty good. Come back. Have you do rotation to the left. Rotation to the right. I mean, if you remember her rotation to the right last time, it was like here, right? So this is already quite a bit different, which is wonderful. And then we can go ahead and do lateral flexion to the left. It's pretty good. How about the other side? Lateral flexion to the right. Looking pretty good. All right. And then last but most importantly, Claire, how do you feel?
I'm good. This feels very open and like space, and this is not. So it's very interesting to have that like comparison side to side.
Oh, yay. I'll take it for sure. Nice. How are you guys feeling? Any questions on anything?
What exercises would you recommend to Claire to help with her restriction or to help her open up in there a little bit more?
Well, simple things like just having her like stretch out her neck, right? So I would have her like do some of these lateral flexions, right? Would be really helpful for just like, you know, getting the muscles open and warmed up and run and moving and stuff like that. She could do some of those proprioceptive neuromuscular facilitation stretches herself. So for like lateral flexion, for instance, I would have her take her head into flexion. She could take this hand, hold it above her head here, right? And give herself some resistance, right? So she's taking her head and putting it towards her shoulder while resisting it with her hands, counting to about 6. Then she'd stop, take a breath, and then see if she could take it a little bit further down the arm. Right? So that would be another nice one that she could totally do herself. Another great thing that she could do for working on things like her scalenes and her SCM is just taking the curl of her fingers. So I'm gonna take this hand and just curl your fingers up, and I'm gonna have you place them right at the clavicle there, right? So again, fingertips type of a thing. Don't go, no, you're all right. I just want you to get too much.
Okay.
So, right, again, she's going right at the clavicle itself. So as she's going through there, if she feels, and this will happen especially like in the morning, right? If you feel some tightness in through there, she can go ahead and give it some like a little bit of friction across the muscle there. Then she could pin it and then take herself in through a stretch. Right? So I would have her do that as well. So go ahead. Go back and forth. Yeah, medial to lateral. Yeah. And then just pin it where you feel it tight. And then stretch your neck out. Right. So I'd probably have her do a couple of those. You could even do this one yourself, right? So if you were to grab it on your neck right here, right? Rotate your head in, rotate your head to the left, grab and take your ear towards the ceiling. You're going to grab onto SCM. Yep. And then as you rotate back across, you're going to come up. So switch it like.
Oh.
So you can do it that way. Okay. Grab it here. Yep. And then as you rotate, you're going to come up. Right, so you can do it that way too. It won't be as great as having a massage therapist do it to you, but you can certainly start to get, again, it's getting blood flow into the area, so you can start to warm up and get into some of that area. Any other questions?
Can I ask one more?
Of course, ask 100 more.
All right. Well, most people, when they come in, they're complaining about their neck. They're like, oh, I slept on it, weird. I didn't really do anything. I just woke up and it hurts like this. And it's usually like, they're usually pointing like really up high, kind of near their occipital ridge there. And I've tried like palpating in there, getting my little raccoon fingers in there. I do traction. And I just have this one person who's like, it's not helping him at all. Like friction isn't helping, like traction isn't helping.
Okay, do me a favor, throw your camera on for me.
Okay.
And will you spin this around so I can see too?
Okay. Oh.
Yeah. All right, so point to where this gentleman has his ouchies.
Can you see me?
Yes.
Okay. It's like right in here.
Okay.
Like kind of by the transverse processes.
Okay. Is it on the right side or the left side?
It's on the left side.
No, that's fine. I'm trying to get the mental picture in my head. That's all.
Left
Is
side.
there something that he does that is making it bad, or is there something that like makes it worse, makes it better? Like when he rotates his head to the left or the right, does it make it worse or better?
Yeah. Lateral flexion to the left hurts. Turning it to the left hurts. Like he always feels like it's pinching.
Okay.
And he always sleeps on his left side. Like he will fall asleep in like a good position, but then he'll like fall asleep on his left side.
Okay, perfect.
He wakes up like that, and I keep telling him not to do that. This is my husband, by the way. That's why I'm.
Oh, okay, nice. No,
Him. But
work on him really quickly. This is so exciting.
Yeah.
No, I hear you. Listen, I'm like, okay, so I'll show you a couple things you could do with him for that. I'm the same way. Like, I wish more than anything I could learn to sleep on my back, but it's just not comfortable, and I never will be. I will always be a side sleeper and waking up with crinks in my neck. So a couple different things you can do, and I find this to be really helpful for them, is to use some of those PNF stretches, right? So one of them you could do is like the one that we did before, kind of take him out into lateral flexion on the side that hurts. I would do it on both sides, you know what I mean? But I would probably take it on the side that hurts. I would brace one shoulder, have the other hand right behind the head, have him take his ear to his shoulder. 2, 3, 4, 5, 6, relax. Take a breath together, and then go ahead and take her into the next range of motion. All right, that would be one thing that I would certainly start to do. The other one that I would do is have him do it with rotation, right? So it's gonna be the same thing. I'm gonna take her head into a slight rotation. I'm gonna put my hand on this side of her forehead, and I'm gonna say, go ahead, push up into me on this side. So try and rotate your head that way. Go ahead, 2, 3, 4, 5, 6, relax. Take a breath together. And then on the exhale, go ahead and take it through a further rotation. I would try some of those, because oftentimes what's happening, in my opinion, is that the muscles are getting tight and kinked up in there. So the more you can get them to do it more you can get them to work to get it to unkink, I think is really helpful.
Okay.
Another one that you could do with those two, and I would do this to both sides, but even
Right.
with those two, you can go ahead and do that, you know, get right into that suboccipital area right there. And I'm thinking right at base of the skull, C1, C2 area, and just very slightly, you're gonna side to side the neck with it, all right? So it's almost like they're saying, I don't know,
Okay.
right? And you can do that back and forth, and every couple of times stop, let them sink in, and then do a nice little traction.
Okay.
See if that helps at all. I would be curious, but that's how I would start to work it. Oftentimes, a little bit of PNF stretching on somebody who's got like a quote unquote kink in their neck will get rid of the kink. Any other questions? That was great. Any other clinic people problems or husband or wife?
We lost you on audio.
Oh, sorry. Any other questions, whether it's clinical people or husbands or wives or anything?
Did I push something?
Perfect.
I don't hear you on my phone
Oh,
either.
can you hear me?
Yeah, we hear you.
Okay.
All right. Anythings? All right, well, let's take 10 minutes. Now would be the time to go set up your space or your table or anything so you guys can get a chance to practice. It's 2:02 now, so take 10 minutes. See you at 2:12, and it will be a chance for you guys to practice some techniques and kind of get into integrative Swedish type stuff. And I'll be able to give you some feedback on it. Again, if you don't have a body, I need you to write out what your treatment plan would be for the neck. And I want you to think about it like you had a half an hour to work on the neck. Tell me what you would do, what side you would do it on, how many repetitions of it you would do, why you would do it isn't necessarily a bad idea, and then what your next step would be. All right, so if you have a body, I'll be excited because then we get to kind of practice it and work on it, and I'll be able to give you some feedback. And if not, I will have you do the written out part for it. I just saw that. I'll put my email in the email box for you when we come back for sure. Can we have your email? You most certainly can. Of course, absolutely. Yeah, so take 10 minutes. I'll see you at 2:12, and we will get some more fun stuff going on.